All right, thank you, Dr. Pearson. Our last lunchtime expert talk will be done by Katherine Meese. Katherine Meese has received a degree in finance from Texas A&M University and a master's in public health. She has worked in Rwanda with the Norman Borlaug Institute, in addition to Thailand, Singapore, China, Vietnam, Bangladesh, and Uganda. She has experience as the International Operations Director and board member of Safe Mothers, Safe Babies, and currently is involved with Methodist International at the Methodist Hospital. Katherine Meese.
All right, so I don't know about you guys, but that cookie makes me want to be in a food coma, so bear with me. We'll try to keep this as interesting as possible. Let me make this full screen. All right, so what I want to talk to you today is about energy poverty. We've had an opportunity to hear some wonderful presentations from human trafficking to how to address local issues here in Houston to clean water. And all of those are really important issues on top of the other global health things that we hear about frequently: malaria, tuberculosis, AIDS, malnutrition, et cetera. And all of those are critically important, but sometimes you hear a little bit less about energy poverty. But this is a really important issue in the delivery of global health services and has a tremendous impact on maternal and child health. So I want to touch on that today. Just a little bit about my background. As he said, I currently work at Methodist International, which is a subsidiary of the Methodist Hospital. We see international patients, about 7,500 a year from 93 countries, and we also do education and training, which is how I'm involved. So I have the opportunity to develop training programs for physicians, nurses, and allied health workers around the world who want to come here to be trained and then take it back home to improve healthcare in their own countries. So I've always had a passion for international health, but that looks really different ways and has looked different ways throughout my career. I definitely thought I'd be living in a hut in Rwanda for the rest of my life. My husband's passion will keep us here in the US. So I just want to encourage all of you who are torn somewhere between a hut and a corporate office that there are ways to get involved and support global health from wherever you are, whatever your life circumstance may be. So I had the opportunity while I was getting my master's of public health to go to Uganda with Safe Mothers, Safe Babies, which is a small kind of grassroots maternal and child health organization that really focuses our work in the Iganga district. So what I'm talking about, while there are some principles that apply all over sub-Saharan Africa, I'm specifically speaking about the Iganga district, just as a caveat. So I just want to tell you a little bit about our story of how we got engaged in energy poverty in Uganda. Energy poverty, as I said, is a really critical issue, and so many of the interventions that we design in public health are hinging on the fact that we'll be able to turn on a light switch at some point. But spending time in some of the health centers in rural areas of Uganda, I realized that this is not always the case, and it causes a lot of problems. So in looking at some of the statistics in the health centers that we were working in, about 4 in 100 women in Uganda will die from pregnancy-related causes during her lifetime. So that's fairly significant, but the question is, why is this happening? Well, I don't know. So we started asking, why? Why are we seeing this rate of maternal mortality in this area? Some of the questions that we got back and some of the things that we started to notice were related to women choosing to deliver in areas away from the health center, even though they may have had very complicated pregnancies. So while there were plenty of women who were having successful deliveries with a midwife or at home, there were other women who really needed to have a team of healthcare professionals helping them deliver safely, and they weren't accessing those services. So we started to ask, why aren't women delivering at health centers? Why are the statistics different in the daytime versus at night? As we started monitoring and tracking data, we realized that during the daytime, women are more likely to go to the health centers than at night. So are people afraid of the dark? Why is this happening? Well, in order to answer some of those questions, of course, the only option is to talk to the people who are there and experiencing that situation. We could guess at the answers, but really we needed to listen to the voice of the community and understand some of those dynamics. So one of the things that we heard is that transport at night is too expensive. The motorcycle drivers and different people who operate transport in this area have a significant price increase to travel at nighttime. So for a lot of the families that we're working with in a very rural farming, agricultural-based business area, we realize that they don't really have money to save up to be able to access that night transport. During the daytime, they may be able to negotiate a better deal, but at night, it's really not within reach. So for those people, they were either walking 1 to 3 to 4 miles to the health center while in labor. Women in the room, does that sound fun? Probably not. Or riding on the handlebars of their husband's bicycle while in labor. Not ideal. So you can understand why people maybe prefer to deliver at home, even if they need the attention of healthcare providers. So what we did is we implemented a motorcycle ambulance program. There's no 911 to call, so to speak, in this area that we're working. So we now have a phone number that women who are delivering can call. We'll pick them up in this motorcycle transport and transport them to the health center at a price that still encourages responsibility and saving up in family planning, but also is low enough for people to access and be able to deliver at the health center. But there was another issue that we ran into in terms of why people didn't deliver at night. We heard, "I'm afraid." Well, why are you afraid? I'm afraid because when I go, it's pitch black. I'm afraid because when I go and it's pitch black, all of the healthcare workers have left. I'm afraid because when I go at night, I'm worried that someone will try to harm me or rob me. So what we did is implemented a small, tiny, little bitty solar panel on the corner of Lubiera Health Center just to see, would this help? Would it make a difference? The solar panel was not that great, kind of a cheaper quality, and we couldn't afford a big battery because we're mostly grad students, but we just wanted to give it a whirl. And actually during our pilot test, one panel alone, which was not nearly enough to light the entire health center, caused about a 200% increase in deliveries at the Lubiera Health Center. So this was a demand generating activity, so to speak, generating the demand for health services at the health center, making it more accessible. So this launched a question of, okay, how can we scale this? If it's what the community wants, how can we scale this? So zooming back to the United States, which is where many people on the team are from, while we do have a full-time program manager in Uganda, we started asking, what can we do from here? I'm a grad student, you are a medical student, I'm a grad student married to a medical student, so we don't have a lot of money. So if we're providing funding, where do we get the money? Is that what our responsibility is just to write checks? How do we create a sense of ownership? Some of the same things that we heard from previous lectures. What if this equipment gets stolen? What is the right technology? There are lots of different solar panels out there, not are all made equal. There are devices that are non-solar based. What is the right fit for this community? What can they sustain? What works for them? And then, of course, how do we create awareness? How do we get people on board with this cause? Maybe people who have money that we don't have. So in asking a lot of these questions, you might, yeah, okay, so, shoot, guys. A little dark over here, so if you have a cell phone, if you could just turn the lights back out, thanks. If you have a cell phone, if you could just go ahead and take it out for me. And maybe just don't turn the flashlight on, but if you just have a screen, if you could point it this way. All right, okay, so how many fingers am I holding up? 3. Nope. Anyone? No, okay, you can't even tell. So imagine that you're in a health center, you're either a healthcare provider or a woman. You're delivering at night, and you are in the middle of a C-section, and the lights go out in the middle of the C-section. So for those of you who are going into surgery someday, you're probably breaking out in a cold sweat right now. You know how important surgical lighting is. What we found in the district hospital that we're working with is that literally people are doing operations and C-sections and delivering babies by the light of a kerosene lamp, by the light of a cell phone, or if you're really, really lucky, by the light of a headlamp that an intern from the United States donated last summer. So as you can imagine, outcomes are poor. You can't see why the baby's not breathing. You can't see when a woman has torn and is hemorrhaging. You can't see well enough to perform a positive outcome surgery. You can't sterilize your equipment because the autoclave isn't working. So when the electricity is out for 12 hours, you run out. You can't keep a blood bank refrigerated. You can't refrigerate vaccines, and the list goes on and on. So energy poverty isn't just an inconvenience. It's not just an inconvenience that people have to experience times of darkness. It's a tremendous impact and factor in child and maternal health. So I just want to close with a brief video. This is from one of our partners at We Care Solar. We work with a physician, Dr. Laura Stachel, who designed the solar suitcases that we use in Uganda. And I just want you to see a little bit of more about her work there and some of the work that we're piloting in Uganda as well. Sorry, I can't see the keys.
There's a traditional African saying when you become pregnant that you have one foot in the grave. There are so many women dying in childbirth in many communities. Pregnancy is feared.
In the last month recorded
4 women actually died from pregnancy complications. When I went to Africa, I saw these women one after another coming in with complications, and we didn't even have adequate light to treat them. Welcome to the world, little one. And the lights just went out. A lot of the clinics don't have any electricity. Midwives use kerosene lanterns. They may use candles. They use their cell phones to deliver babies. Once I witnessed the things that I saw, I had to do something about it. My name is Dr. Laura Stachel. I'm helping to provide a simple and reliable solar lighting and power source so that mothers and babies can be saved during childbirth.
Very, very nice.
Hospitals and clinics receive the solar suitcase for free. So the charge controller is very important. Solar suitcase provides medical quality lighting. It charges cell phones. It has a small battery charger for headlamps and for the fetal Doppler that we include. Perfect. That's it. Mothers are now eager to come to the clinics. It's just shifted the morale of the healthcare worker.
This light is going to bring good changes. It keeps me going.
Turn this on. There you go.
Thank you so much.
You're so welcome.
I really want a world where women and their families get to celebrate birth, and I would love to be part of making that happen.
All right, so in conclusion, I just want to encourage all of you who are involved in global health or thinking about being involved in global health in different ways that there's so many avenues for plugging in. I've always had an interest in energy. I started out as an analyst at an oil and gas firm, never thought it would take me to this point. But follow what you're passionate about, and whether you're living in a hut or on the 50th story of a corporate building downtown, there's something you can do. So thanks so much.